After a hip replacement, you'll be keen to get back to normal everyday activities. So in this video, I'll provide you with gentle, progressive rehab exercises for the first 3 months after your surgery. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I have exercise advice for people with a total hip replacement. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. So the goals of any exercise program following a hip replacement will be to help control the pain, manage any swelling and improve the mobility and strength of the hip that's been replaced. After 3 months, you should be in a good position to be walking with a normal gait, this is without a limp, and be able to carry out normal day-to-day activities. However, it is of the utmost importance that you follow the advice and precautions given to you by your surgeon. This can vary depending on the surgical approach they took for your hip replacement, whether through the front or the back of the hip. As a general rule of thumb, to stay safe and avoid any complications such as a dislocation in the first 3 months, don't bend your hip beyond 90 degrees. This is bringing the knee up towards the abdomen higher than the hip. Don't force the hip past neutral, like taking your leg backwards other than what you would do normally when walking. Avoid rotating the hip inwards or outwards, especially when there is weight through it or if the hip is flexed or abducted, like being sat down with the knees apart. And avoid adducting the surgical leg past the midline, such as crossing your legs. Swimming, particularly the breaststroke, isn't advised either due to the aggressive movement of the hip, so leave this out until after 3 months. After a period of around 12 weeks though, your surgeon may well reduce or remove some of these precautions, but for now, work within your limitations so you can safely build your mobility, strength, balance and confidence back up again. As you will naturally progress during the first 3 months, I've divided this video into 3 phases: month 1, month 2 and month 3. I've provided 4 suitable exercises for each phase of recovery, but you don't need to conduct all 4 exercises, just the ones that work for you. And don't feel you have to move on and stick to this timescale if you don't feel ready. You can prolong some of the earlier phases as much as you need, depending on your own recovery. So listen to your body and always keep your surgeon's advice at the forefront of your mind. Before we go through the exercises for each phase, I want to make one recommendation for your entire recovery period, and that is walking. This is by far going to be the best form of exercise rehabilitation for your hip. Ensure that you begin with your walking aid. This is a crutch, frame or stick. Trying to get a good walking technique using a heel-toe action, staying upright when your body weight is being transferred into the replaced hip, assisted with the walking aids, until you can walk correctly without them. Walking can also be used as a good barometer for your progress and will inevitably be proof that you can resume normal day-to-day activities again. So try and walk as often as possible. Okay, let's now look at some exercises you can do at home for each phase. In this first phase, we will address the initial stages of recovery from the surgery, so we will need to be extra careful with the exercises we choose. Most of the exercises in this phase will be lying, seated or standing but with a support, so you're not full weight bearing just yet. The first one is lying leg extensions. You can do this in your bed, and essentially you need a firm folded pillow placed underneath your knee of the leg that has had the hip replacement. And from a rested position, you'll begin to gently activate the muscles on the front of the thigh to begin to straighten the knee, lifting the heel of the foot off the bed. See if you can get the leg to go completely straight, keeping the back of the knee pushed into the pillow. Hold it for 3 to 5 seconds and then slowly lower the foot back down before starting again. See if you can manage 10 reps of this, and you can progress it if you feel that you need to by having the leg supported a bit higher to create an increased range of movement for the exercise. The next one is seated foot pumps. Whenever you find yourself sat down, you can do this, and it's helping to promote a good blood flow around the legs. All you do is raise your heels off the floor, going up onto the toes, and then roll the foot back, digging the heel down to lift the toes off the floor, going back and forth until you've completed it 10 times each way. Try and maintain as much movement as possible and make sure that your seat is not too low to avoid bending the hip too much. Now we'll move on to the seated butt clench, and the aim is to squeeze your buttocks together, which will feel like your hips are being raised slightly off the seat of your chair. It's a great way to start to activate the muscles around the hips, and you should hold the clench for about 3 to 5 seconds before releasing and do it 10 times. If you find yourself sat down a lot during your first few weeks of recovery, like with the foot pumps, this will help promote your circulation to reduce swelling and reduce the risk of blood clots. The final exercise in this first phase is standing knee lifts. With this one, it's important to make sure that you have a table, kitchen worktop, desk or back of chair to hold onto for safety purposes. We are only lifting the knee of the leg with the hip replacement, so your body weight will be through your other leg. But from a good standing posture, you will raise the knee up in front of you without lifting it higher than the hip to avoid bending the hip more than 90 degrees. Perform the movement 10 times slowly, resting between reps if necessary, but making sure you keep hold of your support at all times. You'll feel this working the muscles in the front of the hip. In phase 2, we'll begin to increase the range of movement for the hip joint, whilst challenging the muscles a little bit more by adding more partial weight bearing exercises through the hip. The first one is a seated adductor squeeze. This one will activate the muscles of the inner thigh, so you'll feel it in the groin. Using a basketball or football if you have one, or a couple of folded pillows between your knees to keep them about hips width wide, think about trying to gently squeeze the ball or pillows between your knees for about 3 to 5 seconds and then release before starting again. Do this 10 times, controlling the intensity of the contraction of the muscles so that you're not being too aggressive. The next one is standing hip abductions. This is performed while holding a support for balance, and you will lift the leg of the replaced hip out to your side whilst maintaining an upright posture. There won't be a huge amount of movement with this, but it will begin to stimulate the muscles on the outside of the hip. Perform this movement slowly 10 times, ensuring you move within your pain-free range of movement, and be sure not to lean the body to the side while raising the leg. Now we will move on to standing half squats. This again is performed like the last one, holding a support in front of you and keeping your weight evenly distributed between each foot and the feet staying flat on the floor. Slowly begin to squat down until your knees and hips are bent a little bit, then return back up to a standing position before starting again. Make sure you don't go down too low, sticking to any precautions you have been given, and aim to do 10 reps, continually holding your support. The final one is a lying bridge. This one will really begin to put some stress into the muscles around the hip, and you can do this laid down on your back in your bed. Start with your feet flat at hips width and your knees bent and your arms at your side for support. Start to squeeze your buttocks together, and as you push the heels of your feet into the floor or bed, raise your hips up, but only as far as the point between your shoulders and knees before slowly lowering back down. You can hold it at the top for a few seconds if you wish, but make sure that you don't force the hips up too high. And don't worry if you don't feel ready to lift them up as high as I'm showing. Just raising them off the bed a few inches will be a good start point. As before, aim for about 10 repetitions. In this final phase, we will aim to continue with progressing the strength and mobility of the replaced hip and start to look at functional movement and full weight bearing exercises, which will ultimately also help you with your balance. The first one will be sit to stands, a great functional exercise, and moving on from the half squats in phase 2, start in a chair that's not too low so your hip isn't bent more than 90 degrees before you start. If needed, place some cushions under your bottom to raise the hips slightly. Have something nearby to hold on to just in case, but the aim is to transfer your weight into your feet by being sat close to the front of your chair and moving your torso forward so you have your nose over your toes. Then lift the hips off the chair using your hands if required, providing you don't twist, and then drive your hips up and forwards until you're standing. Make sure you get your balance first before slowly lowering your bottom back down to your chair. Be careful not just to drop back into your chair without control, as you'll be working the muscles more effectively during this slow lowering phase. Aim to do 10 reps if you can manage, resting a bit between each one if required. The next one is step ups. This one will begin to place all your body weight through the hip replaced leg, so it's important that you perform the technique correctly. Using a step at home that can be from 3 to 12 inches high, the higher it is, the harder the exercise will be, and holding onto a support, place your foot of the recovering leg on the step in front of you. Making sure you don't use your other leg to push off from, place all your weight through the foot on the step and slowly stand up on it, bringing the other foot up if needed for balance. Once you're upright, slowly return the other leg back down to the ground before starting the movement again. As with all the other exercises, perform 10 slow repetitions, and as a bit of variation on this one, you can do it so the step is at your side rather than at the front, but keeping your body upright and square to avoid any twisting of the pelvis during the movement. Now we'll move on to side lying hip abductions. You can do this in your bed, lying on your side, with your hip replaced leg on top. To start with, bend both knees and hips a little bit for improved support, and then you will lift the top leg straight up away from your other leg. The weight of your leg in this horizontal position will really target the muscles on the side of the hip, so providing you do this in a slow, controlled movement, it should feel pretty hard to get to 10 reps. If you find it easy and you need to progress it, then try doing the same exercise but with the top leg straight. Make sure you don't twist your pelvis or bring the leg forwards while raising it, and the foot should be pointing in the direction that you're facing so it's not rotated, and the leg will only move in one plane up and down. The final one is the hardest one of all, which is the split squat, so please take great care whilst performing these. I would advise that you hold on to support at your side, and you can try this with both your affected leg at the front and at the back, providing you stick to any precautions you still have. Start with your feet hips width wide and about 2 hips width in length from the front foot to the back foot, initially trying it with the foot of the hip replaced leg at the front. Keeping the front foot flat on the floor at all times and bringing the back foot up onto the ball of the foot, focus on slowly bending the back knee straight down towards the ground, but only as far as you can manage without compromising your balance or strength. You do not need to get the knee to the floor, that's not the objective. Instead, make sure that as both knees bend, the front hip doesn't bend beyond 90 degrees and the back hip doesn't extend behind you during the movement, so it stays in line between your back knee and shoulder. Keeping your torso upright, you then resume back up to a standing position and start again. Aim to do 5 of these, and if you feel confident enough, then you can change your feet over to try and do 5 reps the other way. You may find one version harder than the other, so if necessary, stick with one variation until you feel that you can move on. Other exercises you can try at this stage to move your recovery on, and if you have access to the equipment, include the use of a stationary bike. If you can get to use one, then make sure your saddle is up high enough or pushed back enough if on a recumbent bike to avoid bending the hip too much while pedalling, and see if you can gradually build up the amount of time you spend on it from about 5 minutes up to 20 minutes. An air cushion or wobble board can be really useful at engaging other deep muscles around the hip. You can perform some gentle short range movements to distribute your body weight between each leg, or even try just balancing on it. Most importantly though, don't forget to walk, as this will undoubtedly be the best functional exercise you can do to aid your recovery. You can do these gentle rehab exercises every day, and after 3 months you should be in a better position to resume normal day-to-day activities and carry out popular exercises in a gym or group class setting, but use your experience of your progress and your review with your surgeon to make that decision. I hope you can take something away from this video today, and let me know which exercises have helped you in the comments below. Please give this video a like by clicking the thumbs up button below, and share this video with friends to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel, or click here to watch a recent video. See you soon.